Hello. The purpose of this video is to talk about the invasive cardiac tests as opposed to the non-invasive tests, which include echocardiography and exercise testing. We're going to talk now about coronary angiography and coronary angioplasty. Coronary angiography is where you take pictures of the coronary arteries to find out where the blockages are, and coronary angioplasty is when you actually fix them. Now, in both of these cases, we put tubes into the body through the vascular system, either through the wrist or through the femoral arteries, which are big arteries that we can use. Then we use tubes such as this to inject radio-opaque dye. This is dye that isn't colored, but the X-ray can't see it, so it shows up on the X-ray picture, and we get a moving picture of what the coronary arteries look like. In the case of coronary angioplasty, we then follow that by putting a little wire down the artery and then a balloon. The balloon will then open up the artery, and usually what we do then is leave a stent behind. These stents can either be bare metal stents, which is just made of steel, or they can be coated with drugs, particularly drugs that prevent re-narrowing of the artery over the next few months. So that's a coronary angioplasty. As I said, most often coronary angioplasty is done through the wrist, and we will use the wrist artery, and then the catheter will go from the wrist up into the heart like this, and then the wire and the balloon will be passed through this tube into the heart, and the narrowing opened up with the balloon, and then the stent left behind. I'd like to just show you what the balloon and the stent look like. I have an example here of a catheter that has the balloon on it, and what we would use is a device such as this to inflate the balloon. Typically pressures of anywhere between 4 and 20 atmospheres of pressure are used to open this balloon up. Now what we'll do is we'll have a look carefully at this balloon here that has the stent on it, and then you can see the balloon inflate and deploy it. After a procedure like this, particularly when it's done through a radial approach, a clamp would be put on the artery and the artery occluded for a period of 2 hours. The patient will then stay in hospital for a period of usually 12 hours overnight. Sometimes they're sent home that same day, and we'll be taking aspirin and Plavix for a period of 6 months to a year or two after the procedure. Usually normal activities can be resumed within a period of 24 to 48 hours, unless the patient has had a heart attack, in which case usually a period of convalescence of 2 to 4 weeks is required. Complications of angioplasty are minimal nowadays, but we do always have to have the potential of requiring bypass surgery, and in those very unusual cases, which is somewhere in the range of 1 in 1,000 to 1 in 2,000, a patient may require a bypass operation because we're unable to fix the narrowing with a balloon and a stent. But normally, as I said, the patient goes home the next day, and the symptoms are relieved within a matter of hours, the symptoms of angina that they had before. There's one other group of patients that we do treat here, and this is an exciting group. These are people that are actually having a heart attack at the time. And the important thing there is that a heart attack takes somewhere in the range of 1 to 6 hours to run its course. So what we try and do is get these patients into this catheterization laboratory within a period of 60 minutes after the onset of symptoms. In fact, we have the EMS people bring them directly to our hospital from their home, where the diagnosis is made on an ECG, and the team comes in and meets them there, and typically we can get the artery opened within a period of 60 minutes from the onset of symptoms. And when that happens, often very little heart damage occurs. And this is an exciting development that has resulted in a significant reduction in both the size of the heart attack and the complications that patients can sometimes have after heart attacks. So the important thing there is to make sure that if you're having chest pain, that you call the EMS or go to the emergency department quickly, because the time frame is about 6 hours, after which the damage is complete and there's not an awful lot we can do. But when a patient calls quickly, we can often get that artery open 24 hours a day, 7 days a week, within 60 to 90 minutes of the onset of symptoms. And that's when the most significant reduction in mortality occurs, when we open the artery up quickly. So I hope this has been helpful to you. Again, I'd like to remind you that if you have any questions with regard to angioplasty, if you're going to have this procedure, make sure you talk to the doctor who's doing it. Make sure you ask any questions that you have. Make sure you understand fully the risks and benefits of the procedure before going ahead. but I hope this has given you some understanding of what you might experience if you're booked for an angiogram or an angioplasty. Thank you.